Hello everyone, my name is Miriam Piloya, a graduate midwife, and I'll be taking you through the professionals of midwifery. Before we start this presentation, I would like us to discuss something small. Midwifery is not something that you just decide to go for and you succeed. Midwifery needs someone who is empathetic, someone who is caring. As they say, it's a noble profession. It needs someone who is empathetic. You need to put yourself in someone's shoes all the time. You need to sacrifice. It involves a lot of sacrifices. So, if you're going for this profession, you must put in mind that you have to be caring, empathetic, and you must be ready to sacrifice. Okay? So, let's dive straight into our presentation. Today, we shall be discussing about the profession as a whole, and some few aspects of it. When they say midwifery or a midwife, what comes into your mind? Let's say you are a third year student of midwifery and a random person on the road asks you, who is a midwife? What is midwifery? What will you say? A midwife is someone who is highly skilled to provide care to pregnant women during their pregnancy, childbirth, and postpartum. And this care has to be holistic. When we talk about holistic care, it means care in all aspects of life, not just physical health care, but spiritual, emotional, social aspect of life. Let's look at the global history and trends of midwifery. Midwifery has a long and diverse history across all cultures in the world. Of recent, there has been growing interest of midwifery, interest in such a way that people have started liking what midwives does. And many countries have started putting a lot of effort, resources, capital in order to improve the work of midwives. Let's look at the midwifery history in the Republic of South Sudan. The Republic of South Sudan has a rich tradition of midwifery care provided by skilled birth attendants within the local communities. Yes, we understand that the country has been going through a lot of challenges and is still going through a lot, and we don't know what the future holds, and it might still go through a lot of problems. But one thing we appreciate is the country is doing a lot to improve the quality of services provided to these pregnant women or women of reproductive health at large. They have been coming up with trainings, initiatives, in service trainings to enhance the skills of these midwives so that quality services can be provided to these mothers and these women of reproductive health age. What are the characteristics of midwifery as a profession? The first one is expertise in normal pregnancy and childbirth. For someone to be called a midwife, that person must have the knowledge, the skills to conduct normal deliveries at childbirth. The second one is continuity of care. A midwife has to establish a one-on-one relationship, a trusted relationship between her and her client. When I talk about client, I'm talking about the pregnant mother, the spouse, or actually all women of reproductive health age. Advocacy and empowerment. When you talk about advocacy, we are meaning like talking for someone, talk on behalf of someone, on the minority groups, advocating for their rights. And it's a responsibility of the midwives to advocate for the rights of these pregnant mothers. How do they do this? They do this by involving themselves in policy making, advocating for more resources to be used on them so that better and higher quality services can be provided to them. Let's look at the model of midwifery care. When you talk about the model of midwifery care, we are mean a type of care that is given to someone. And this type of care corresponds with someone's need at that particular time. So someone's need at time A might not be the same as someone's need at time B. You get the point. So if we look at midwifery mode of care, when we talk about the midwifery mode of care, we are trying to see what type of care is given to women of reproductive health, women who are pregnant, women who have just given birth. What type of care do we give to them? And this type of care is always woman-centered. When we talk about woman-centered, we are meaning it just focus on the woman and the child alone, and it's holistic. When we talk about holistic care, it's care as you care for the person's health in general, not just the physical health. We talk about the emotional health, the social well-being of the person, the spiritual well-being of the person. All that encompasses holistic care. And we have three major principles in midwifery mode of care, as we shall discuss in the coming slides. The first one is promoting natural birth. It actually midwives always prioritize natural birth. They try their level best to make sure that someone gives birth naturally. They support their women to experience natural birth and natural or normal physiological processes. And when they're doing those services, they ensure that whatever they're doing is evidence based. It's put down and it's proved to be healthy and it's not harmful to the pregnant mother or unborn child. And when making decisions, they don't always make decisions for their pregnant mothers or their women. They always ensure autonomy is being practiced. They explained everything that the mother needs to know, and they avail the possible solutions to the problem, and they leave it up to the mother to choose which one he or she wants. The second principle is respecting women's choices. Women always respect what their clients. When I talk about clients, I'm talking about the pregnant mother, that woman of the reproductive age, or their spouses. That's what I'm talking about. The client. Actually, when I talk about a client doesn't mean someone who is sick. A client can be someone who is sick or not sick, but requires your services. So when you hear me talk about client all the time, just know I'm talking about the pregnant woman, or I'm talking about that woman of reproductive age. I'll talk about the spouse of those pregnant women. You get the point. So here they talk about respect of women's choices. Yes, we come up with information. We as midwives, especially when problems arises or we need to take a step, we come up with information. We tell them what is happening at that particular time. We give them other options. We give them things that can be done to solve the problem, and we leave it up to them to decide on what can really be done. Okay, let's continue. We always ensure that we give information to these mothers. We give them detailed information about what is happening. We give them possible solutions to the problem, and it's up to them to choose what they really want to go with. We don't have the right to decide on their behalf. Provide individualized care or support. As I talked about it earlier on, what we midwives do is carrying out one-on-one care, individualized care. What client A needs does not necessarily means what client B needs. So what we always do, we always ensure that we do one-on-one care. You treat your mother or you care for your mother in accordance to her needs. You don't generalize. You don't generalize that mother A needs this. So I think mother B must also be needing this. No, it doesn't work like that. You have to take care of your mother singly, individually, take care of the mother's needs singly, and build a trusting relationship between you and your mother so that your mother can easily explain, tell you what her problem is, and you'll be able to take care of the mother properly. You get the point? Okay. Let's look at the roles of midwives. The first one is to monitor the health of both the baby and the mother. You always give prenatal education, you support them, you offer guidance on health, healthy lifestyle choices. Most of these things are done in antenatal unit. When you talk about antenatal units, these are units that it's just for those who have not yet given birth. In such places, we give health education, we give medicines, we give net, and we give other services to those mothers who have not yet given birth. We always and in that unit we always identify problems or complication that is there in pregnancy, and we try to manage. We collaborate with other midwives or healthcare professionals to make sure that such problems have been handled. We as midwives also, it's our responsibility to monitor the progress of labor. During labor, we have to provide pain relief options. We have to offer emotional and physical support throughout the birthing process. As we know, labor and delivery is something that you should not joke with it. It's a very painful procedure. It's emotionally draining, physically draining. So it's up to us. Put as I said earlier on, you have to be empathetic. You have to put yourself in the mother's shoes always. The mother is going through a lot, and all she needs is our care, emotional support, physical support. And when you do that, just know the client will be extremely satisfied. It's also our responsibility to offer support during breastfeeding, newborn care, and maternity recovery. Sometimes, especially for first time mothers, they don't even know how to breastfeed, especially if you get one who has not been going to antenatal visit. She has not been taught how to breastfeed. She does not know what to do. And it's our responsibility to make sure that she starts knowing how to breastfeed. We initiate breastfeeding. We teach them how to hold the baby when breastfeeding. You tell them the hygiene during breastfeeding. It's your responsibility as a midwife. And you cannot run away from it. That's why we say it's motherly. It's a motherly profession. You need to be caring. You need to be loving. You need to be empathetic. Put yourself in a mother's shoes when you're doing anything. In midwifery, it's just about love and care. You take care of the newborn. Teach the mother how to bathe the child. Teach the mother how to take care of the cord. That is your responsibility as a midwife. A mother has delivered, a lot of changes has happened. It's your responsibility to take care of the mother throughout her recovery. You get the point? Talk to her about the hygiene. Tell her about the things that will happen in her body immediately after delivery. Tell her that possible things. Reassure her those things are normal, and that it will by time slowly it will come to pass. That is your responsibility as a midwife, and you can never run away from it. And that is where the joy comes from. See the baby that you have helped the mother deliver, laugh, cry, make their first word. Those are the joys that we experience, nothing more. That's why you have to be caring, you have to be loving wholeheartedly from the heart. And let's go to the next one. It's also the responsibility of a midwife to assess and address any physical or emotional challenges that may arise during postpartum period. You have to promote the well-being of the mother and the baby. When we talk about postpartum period, it's a period immediately after delivery to 6 weeks post delivery. During that people during that period, women go through a lot actually, emotionally, physically, they go through a lot. Their bodies are changing. Sometimes they even go through a postpartum depression. It's your responsibility to care for her, to reassure her that everything will be fine, to talk to her. You have to build a one-on-one trusting relationship between you and your client, so that she can tell you what is really happening, she can tell you her challenges, so that you can easily help her. That is your responsibility as a midwife. Let's look at midwifery and the continuum of care. Midwives provide care throughout the reproductive cycle, from preconception to postpartum. Midwifery is not just about pregnant women. It's not just about women who have just given birth. It also starts right from those who have not yet given birth but are at the age of giving birth. Women of reproductive age. Your work starts right from there. You talk to those women, you give them preconception counseling, preconception medication. That is your responsibility. And at 6 weeks postpartum, you always give them, you can talk about family planning, give them preconception counseling, offer your antenatal care, you ensure and comprehensive support for these women and their partners, especially in the ANC. When you talk about ANC's antepartum care, you don't just care for the mother, you need to also care for the spouse of the mother. Midwifery and advocacy. As I said earlier on, advocacy just means talking on behalf of someone, advocating for someone's rights, and it's the responsibility of us midwives to advocate for the rights of these pregnant mothers, the rights of these mothers of reproductive age. If we don't do that, who is going to do it for them? It's our responsibility. How do we do it? We ensure that there's equitable access to quality services, quality care. We always make sure that we ask them their problems and address those barriers. We promote policy changes prioritizing their health. We also actively participate in professional organizations, community initiatives, and policy development and to enhance or advance the field of midwifery. If we don't do that, who is going to know that we the midwives want this? We the pregnant mothers want this. It's our responsibility to voice our our needs out. If we don't voice our needs out, who is going to do it for us? It's our responsibilities. Sorry. Let's look at midwifery research and evidence-based practice. As I said earlier on, everything that we do is midwifery should be evidence-based. When we talk about evidence-based, it should have been tested and confirmed that it does not cause any harm to our pregnant mother or a unborn child. So everything that we do should be evidence-based, should have been put down that has no harm on the baby or the pregnant mothers. And when we are practicing, always follows those guidelines. And also, we also, how should I say it? We also actively contribute to research. We always conduct studies to improve the maternal and newborn outcomes. As I said earlier on, midwifery is a caring profession. You have to be empathetic. You have to sacrifice. At the same time, you also have your life ahead of you. You have a career, and you also sometimes you need to develop your career. You can take the path of research. Research is a very interesting path. You can take that path, and your work will just be to research about things related to pregnant women, women of reproductive age, newborn babies. That can be the path that you can take in midwifery. Midwifery and collaborative health. Let's look at that. When we talk about collaborative care, we are meaning care that comes from different angles, not just from midwives. You work hand in hand with other professionals, healthcare professionals, to ensure that mothers get comprehensive, proper care. You always, as midwives, always try to work in multidisciplinary teams. You always try to consult, and if you don't know something, you try to refer to obstetrician, pediatrician, or other specialists that might help. For example, you get a mother with postpartum depression. That is not exactly your role to do that because you don't know. You refer those mothers to the psychiatric units, to the psychiatrists. That is their responsibility to bring the mother back into reality. That is their work. You get a mother who is extremely depressed, a mother who is stressed. You call a social worker, you call a counselor to come and help. That is what we call collaborative health. You work as a team. You don't just work alone. Midwifery is not just about working alone. If you don't know anything, you refer the mother. You call upon other professionals to come and help you. It's just collaborative care. And this collaborative care ensures women will receive holistic care and integrated healthcare services throughout their reproductive journey. Let's look at midwifery education and training. Midwifery education encompasses a combination of theoretical knowledge and practical. In most of the countries generally, they include coursework, clinical rotation and supervised practice. Midwives undergo rigorous training to develop competencies in antenatal care, labor and birth, postpartum care, and newborn care. Let's look at the scope of practice. Sorry, I'm back. Let's look at the scope of practice. When we talk about the scope of practice, we are just meaning to what extent you can go with your work. What are your boundaries? What are the things that you can do and what are the things that you cannot do legally? You have to know your legal boundaries as a midwife because you don't want to fall into trouble. Because when you do that things that is not within your scope of practice, you can easily be sued. Your license can easily be provoked, and that is a list of the things we want. So whatever you're doing, anything, you must be sure that it's within the scope of your practice, within the boundaries, within the things that you are allowed to do legally. And it's your responsibility to collaborate with other healthcare professionals within the scope of practice. For example, you cannot go ahead and collaborate with, let's say, witch doctors that you're giving a multi and holistic care. You want to collaborate with a witch doctor? No. When you're collaborating, you collaborate with healthcare professionals. You don't just collaborate with market vendors. No, it doesn't work like that. Those are not within the scope of practice. You always have to avoid procedures, carry out procedures that are not within your reach, not within your scope of practice, not within your boundaries. Because when in case anything happens, you can easily be sued, your license can easily be provoked, and that is a list of the things you want as a midwife. Not just a midwife, healthcare professional. Let's look at midwifery regulations and licensure. Like any other healthcare profession, midwifery is a regulated profession. Why do they do that? You're dealing with human being, you're dealing with a live person, and for the case of midwifery, you're dealing with two living things in one. Their safety, their well-being is our priority. That's why it's always regulated. The body always makes sure that for someone to work on a pregnant mother or a human being, that person should be fully qualified. That's why there's a regulatory body that always governs midwifery. And this regulatory bodies also ensure that before you start working, before you start patients, you have to be having license. And it's their responsibility to give you the license after you going through serious examination, after you going through test, after you going through all the things that they need, and you get your license. Let's look at midwifery regulation and licensure in South Sudan in particular now. As we all know, the Nurses and Midwifery Bill has not yet been passed out by the parliament in Sudan, but by now we have Nurses and Midwifery Council of Sudan acting to give us this licensure, and any midwife or nurse that is willing to register can do so with the Nursing and Midwifery Board or Council of Sudan. Let's look at professional competency. When we talk about professional competency, we are talking about the knowledge and the skills that a particular person should have to ensure that he or she delivers quality services. And for the case of professional competency in midwifery, you have to maintain an up-to-date knowledge and skills. You have to know that updates, things that have been updated, you have to always ensure that you don't forget certain procedures. There are procedures that those days used to be valid, but they've changed. That's why you have to maintain an up-to-date knowledge, knowing what has changed, what has been brought up, what has been dropped, so that you don't fall a victim of what we talked about, legal boundaries, things that you're allowed to do and things that you're not allowed to do. You have to be updated on all those things. How do you do that? You can do that by participating in service training like CME. You can do that by doing professional development. For professional development, can include going for workshops, conferences, CMEs, and other things. As we talked about earlier, evidence-based guidelines. You should always make sure that you know all those guidelines. You should always make sure that whatever you're doing, it's within the limit. Whatever you're doing, it has been proven that does not cause any harm to our mother, does not cause any harm to our woman of reproductive age, does not cause any harm to our baby. And that is our priority. Let's look at midwifery and professional development. Midwives are committed to lifelong learning and professional development. As we said earlier on, it can be through continuing educations, can be through attending conferences, can be through participating in workshops to enhance their knowledge and skills. Professional development can also help midwives to stay up to date, should know the latest in the field, should know what has been added, what has been dropped, things that they are supposed to do, things that currently they are not supposed to do. And by doing that, we shall always ensure quality service provision to these pregnant mothers, these mothers who have just given birth, and to these women of reproductive age. Sorry. Let's look at midwifery and the role of technology. As we earlier on said, as midwives, we always try to make sure that our mothers go through the natural process of giving birth, the natural process of delivery, and the natural process of everything. We always want everything to be natural. But that is not always the case with this growing technology. And technology is not very bad. It has also its advantages. It has the potential to enhance midwifery care and improve outcomes. There are other machines that we have started using, we as midwives, that can help us to monitor both our mother and our baby. Let's say, for example, cardiotocograph. We always use it to monitor the future heart of our baby, which is very good. We shall always be at the know if our baby is doing all right or if there's a problem with our baby, and we shall be always be able to do something to intervene in time. Let's look at midwifery and the global maternal health agenda. Midwives are very important personnel that has to be included to achieve the global maternal health agenda. And this health agenda includes the Sustainable Development Goal, which is to reduce the global maternal mortality ratio to less than 7 per 100,000 live births by 2023. How many years are we left with? 5 years now to achieve this. But the way you see it, can it be achieved? That is your food for thought. At what can be done for you to achieve that? If you feel it might not be achieved by 2023, what can you do? What can other people do to accelerate that? That is a food for thought for you. Midwives always try to reduce maternal mortality by improving access to quality care, by promoting reproductive rights, by advocating for the rights of these pregnant women, by advocating so that enough resources are being supplied so that they can give quality care. Let's look at the ethical principles in midwifery. When you talk about ethical principles, things that must be done by a midwife to ensure quality services, things that has to be done, it's a must for a midwife. I think not just a midwife, in healthcare profession. When carrying out your care, what must you do? The first one is autonomy. Actually, we have five major principles in midwifery, and others are also there. But first, let's look at the five major ones. The first one is autonomy, respecting the woman's right to make decisions about her health care. As we said earlier on, it's your responsibility as a midwife to provide the woman with all the information, and you should not always be biased. Be truthful, be realistic. You have to provide the woman with all the information that she requires. give her the possible solutions to the problem, and leave it up to her to choose what she wants to go with. It's on her who has a right to make the decision, not you. And that is what we call autonomy. Let's look at beneficence. You should always act in the best interest of the mother and the baby. For example, let's say a mother's come, you have seen there's a problem. Let's say, I can't say postpartum hemorrhage, we are still very young, maybe we have not yet taught you people about this, so we can't talk about that so much. You understand as time goes on, but it's your responsibility to act in the best interest of the mother and the baby, always. Non-malfeasance. You should always avoid harm the provision of care. Justice. You should always be fair in distribution of resources and equal access to care. Let's say you have two mothers. You can't give mother A all the drugs that she requires, and you give mother B few or some of the drugs that she's supposed to get, instead of giving both of them all or both of them some. You have to be just and fair. The fifth one is accountability. You should always be accountable. Admit your mistakes in case one happens and try to work hard to rectify that mistake. Those are the five major principles in midwifery: autonomy, beneficence, non-malfeasance, justice, and accountability. Then we also have other principles in midwifery. Yes, we have the major six or five, but there are others that we have not talked about it in the previous slides that are still very important. And one of them is informed consent. Ensuring that the woman understands the risk, benefits, and alternatives. As I said on earlier, you have to always give information to the mother. When you want the mother to accept for you to do any procedure, it's your responsibility to tell her about the procedure, to talk to her about the risks that involves that procedure, to talk to her about the benefits of that procedure, and what other things can be done apart from that procedure. And it's up to her to say yes or no to your request. confidentiality and privacy. You should always make sure that all the information that the pregnant woman gives you, or the lady gives you, it's always kept confidential. You should not always be spreading everything that your client gives you to other people. You should always safeguard a woman's personal health information. You should try your level best to ensure privacy. Like, for example, if a woman or a mother tells you, I feel very uncomfortable when so many people are around, ensure that people are not there. Respect her privacy. If you're carrying out a procedure that involves undressing her, ensure that there's a screen. Make sure that her privacy is just intact. And that is what we call quality provision of care. So let's look at the ethical issues in midwifery. Yes, we have principle in midwifery, things that we are supposed to do as midwives, things that governs our work as midwives. But also we have the ethical issues, things that challenges us, dilemmas. We also go through dilemmas. These ethical issues most of the time are dilemmas in midwifery. Let's look at the first one. Conflict of interest in midwifery practice. For example, yes, it's the right of the pregnant woman to make decisions about her health. But what if that decision is not good for the baby, harms the baby? What are you going to do? The woman has made a decision, it's her right. So what will you do? You have to be within your lane as a midwife, not to make decisions for your pregnant woman, but at the same time, you see that the decision that she has made is harmful for her or her unborn child. Those are the dilemmas that we as midwives we can be in, and it's called conflict of interest in midwifery practice. So what will you do? You have to be transparent, and you have to tell her the harm, the potential harm that can cause to the baby or her, and you have to request her to change her decision, to request her, not to order her. Talk her out of that decision. Let her make another decision. That is your responsibility as a midwife. Another dilemma is allocating limited resources. Yes, we talked about being fair and just, but sometimes the resources that can be provided can be so limited, and you can't treat mother A like mother B. Let's say you have enough drugs for one person, but some half of the drugs for the next person. What will you do? You don't have enough resources. It's not your fault that you're not giving quality equitable services, but just because there's limited resources. So automatically one person will get full dose of everything, then the other of course will get half. And that is what we call unequitable service provision. But it's not your fault. It's just because the resources are limited. And those are some of the dilemmas that we go through as midwives. What will you do in case such happens? You should always advocate for equitable distribution of resources. As we said, advocacy. It's your responsibility to advocate for those things. You see that services are not provided equitably, resources are not being allocated well. It's your responsibility to challenge those policies, to advocate for equitable resource provision so that you don't face such dilemmas again. It's just a continuation of ethical issues. Medical errors and disclosure. Sometimes, as they say, human beings are not machines. They're not 1% perfect. Things can happen. You can make a mistake. And those are the dilemmas that we go through. You realize that you have made a mistake and you don't even know what to do. What you should always do is to actually accept that you have made a mistake, recognize your mistake, and try to address those medical errors or mistakes before things goes out of hand. Accept it, talk to it, talk about it with your other healthcare providers, see what can be done to reverse what you have done. Always try to admit in time. Then the last one is emerging technologies. Yes, we talked about it. We as midwives, it's not in our best interest to go artificial. We want everything to be natural. But at the same time, you see that technology also has some advantages. It helps us a lot. Now the challenge comes in balancing. You'll see there's a particular technology that has come up. It's so good in the essence of monitoring the fetal or maternal well-being. At the same time, it has also disadvantages, can cause harm to our baby or our mother. So what will you do? Those are the things that we go through, the dilemmas. It's food for thought. What will you do as a midwife? There's a technology that is there. It has advantages, disadvantages. What will you do? Weigh the advantages and weigh the disadvantages. See what outweighs what. Then you see what you can decide. Let's look at the ethical dilemmas in end of life care for mothers or newborn. Palliative care, life sustaining interventions and withdrawal of care. For example, you have a client. When we talk about palliative care, it's care for those who are already dying. Yes? And there are some interventions that you see that it's lifelong. Let's say a patient has been put on oxygen, and you very well know that once you remove that oxygen, that patient is going to die. But at the same time, you know that that patient is going to stay on that oxygen for the rest of their lives. What will you do? You have an attendant telling you, just withdraw the care so that she rests. But you don't know what the client or your pregnant mother or your mother is going through there. You don't know what she wants, and you cannot just withdraw like that. And those are the dilemmas that we as midwives will go through. And what will you do in such a situation? Involve other ethics committee and interdisciplinary teams to help you in decision making. You can't just decide about that on your own, as it has some risk involved. Let's look at some of the reproductive rights for the mother. It's your advocating for reproductive rights and autonomy. You as a midwife, you have to ensure that there is access to family planning, access to contraception and safe abortion services. It's your responsibility and it's the right of the patient to support women's choices regarding childbirth and reproductive health. Let's look at integrity and professionalism. Professionalism just means upholding high standards of your profession, acting in accordance to your profession, maintaining honesty, integrity, and accountability. You always reporting any concerns or unethical practices. Let's look at patients' rights. Respecting the woman's right to dignity. Patients have the right to dignity, privacy, and respect. Access to comprehensive and unbiased information. Our clients have the right to know everything that is happening with their body, everything that you're doing, and you should not hide or twist any information because that is their right. They have to know the complete truth about what is happening to them and what might happen to them as time goes on. It's their right to know. And they have the right to make decisions about their health. That is their right. Let's look about let's talk about professional liability. These are legal responsibilities for the consequence of professional actions or omissions. As I said earlier on, boundaries are very important. Knowing your scope of work are very important. And when you breach it, you're prone to professional liability. Consequences of professional action or omission, legal consequences. Take legal responsibilities of your actions. What are some of the legal standards of care? Midwives are expected to provide care that meets the legal standard of practice. Standards of care may vary by jurisdiction. Yes. When we talk about jurisdiction, different bodies that handles different professions within the country or within different countries. Let's look at negligence. Negligence is just failure to meet the standard of care. Which can result into harm to the patient. Elements of negligence can include duty of care, breach of duty, causation. If we talk about causation, it's causing harm to the patient, and damages. Let's talk about the types of professional liability claims. Birth related injuries to mother or the baby. Failure to diagnose or treat a complication. You can face legal issues. Medication errors. Informed consent issues. Documentation errors. Those are all types of professional liability claims. Let's look at them one by one. The first one is birth related injuries to both the mother and the baby or to one of them. Let's say it's delivery time. You are so absent minded. Mother is on the couch, delivery couch. You're not supporting the mother. Mother falls out of bed. You can easily be sued. Your license can be provoked because it's you who has caused it. You have not been concentrating on the mother. You have not taken very good care of the mother. Failure to diagnose or treat complications. Yes, we know that we are not good. We as midwives, we are not good. But there are some diagnoses that can be so obvious. And you can even fail to diagnose. And when a mother dies and they start auditing the death, they realize that you have failed to do these things that are really obvious. You can easily be sued. The client's family can easily sue you for that. And you take legal access for your responsibilities. Medication errors. When you give the wrong medicine for a given client, you can be sued for that. Informed consent issues. Issues like deciding for the mother instead of letting the mother decide for her. So issues like hiding information from the mother, giving based information to the mother, you can be sued for all those ones. Documentation errors. When you have failed to document what you have done and something happens, or when you have documented wrongly on in a wrong file, you can be sued for that if anything happens. Let's look at professional liability insurance. These are coverage that protects midwives against claims related to professional negligence and errors in practice. Can also be non-professional indemnity insurance. What are some of the strategies to minimize professional liability risk? Maintain accurate and thorough information, recording, documentations, proper documentations, and document everything you have done. They act as proof, and if anything happens, they will always come back to your documentations. They'll go through what you have done, what you have documented that you have done. So you have to ensure that your documentation is proper, clear, and logical. Communication and informed consent. You should always talk to your mother. Provide enough information about what is going on, and you should not always be biased, and ensure that the mother decides on her own what she wants to be done, not you to decide for her. Continuing education and staying up to date on best practices. As we all know, you have to stay up to date about what is happening. You have to know the changes that have been enacted. You have to know things that you have been stopped from doing and things that you have been encouraged to do, so that you don't fall a victim of breach of boundaries that can land you into legal issues. Collaborative care and consultation when needed. When you don't know something, consult so that you don't make mistakes. You don't make errors. You don't do things that can land you into trouble. You should always collaborate with other healthcare professionals. Refer If you see that something is not happening right, you feel, I don't know this, always refer. Don't do things that you don't know because it will land you into troubles, legal issues, something that you don't know and you don't want. Implement equality improvement initiatives. Participate in peer review and case conferences. This peer review can help you a lot in updating your information. Up- It can help you a lot to know things that you have not been knowing. It can give you new information which will help you in your practice so that you don't make mistakes. These conferences can make you get up to date information about what is happening right now, what is supposed to be done, and what you are not supposed to do currently as a midwife, which will further help you to avoid those legal issues. Ethical consideration. Ethical implication of professional liability. Balancing the duty to provide safety and competent care with respect to women's autonomy and rights. You should always be transparent, you should always be honest, you should always be open in case of adverse effects or adverse events. That brings me to the end of my presentation. Thank you very much. I hope you enjoyed the presentation. I remain Miriam Pillar, a registered midwife. Thank you.